A study presented at CROI, virtual CROI, that looked at these same issues was a study that looked at a little under 1,100 patients who were starting a dolutegravir regimen for two of them with either TAF and FTC or TDF and FTC. And the purpose there was to help delineate the contribution of TAF versus TDF in the presence of an integrase versus an old-fashioned regimen, efavirenz, TDF, and FTC, which had been the WHO recommended. The rationale for this study was really to compare efficacy at the time as well as changes in weight, because efavirenz had been the WHO guidelines prior to integrases being suggested as a substitution. So this study allowed for the comparison of the old versus the new standard, and also a difference in the nuke backbone to see if it made a difference in terms of weight. And study visit baselines were done frequently during the 96-week period, as you see below. Open label studies where patients knew what they were getting. And the advanced study results are pretty clear here. And women, especially women on a TAF, FTC, DTG regimen, gained the most weight. Next was a TDF, FTC, DTG, and efavirenz gained the least. That same approach replicated itself in men, but was truncated. In women, you saw a weight gain after 96 weeks of close to 8 kilograms in the TAF arm, compared to in men 5 kilograms. About 6 kilograms in the arm on TDF DTG over 96 weeks in women, compared to 4 in men. And efavirenz in women, you saw a little under 4 kilograms over 96 weeks with TDF and FTC, compared to 1 kilogram for men. So clearly, gender-based differences in response to weight gain matter. And whether they matter in particular for specific agents, either integrases or non-nukes, appear to be borne out in this study. When you look at the changes in obesity, in treatment-emergent obesity, so a change in BMI class, you can see differences here in the regimens, which a much higher prevalence of a move to a higher BMI in patients on TAF, FTC, and DTG compared to certainly to the other regimens. And you see you see less with TDF, but the least amount with efavirenz in women. And you see the same pattern, though severely truncated in men, showing again a real gender difference. And so you get a sense that these differences are certainly have a significant component of gender.